It's Dr. Hudak of All About Aesthetics, where we're all about you and where we want you to look young naturally. I'm going to be talking about something today that I really love to do and I'm best known for, and that is lid lifts. Lid lifts, also known as Blepharoplasty surgery of the lids. It can refer to lid surgery of the upper lids or the lower lids. When a person has a consult with me, the first thing I do is try to get a feel for what it is that bothers them, whether it's the upper lids, the lower lids, or both. If it's the upper lids, another consideration I have to make is there involvement of the brows? Do the brows have equal amounts of height? Is the height normal for that gender? Is the contour symmetric? All of those things have an impact on the decision making of how best to make the person look younger in a natural way and in a more beautiful way. So what I can tell you is that on lower lids, what has occurred over the last couple decades especially is we now have some ways to address lower lid fullness without having to resort to surgery. Sometimes we find that the person's lower lid bags, as people often refer to them, are actually more of a consequence of the bones of the eye socket shrinking and causing what fat pads they have to be more noticeable. And in that case, we often address with a volumizer such as Sculptra or a vampire facelift, or which uses their own plasma from their blood, or we use Radiesse or any number of hyaluronic acid volumizers, and we can make the lower lid fat pads kind of disappear by addressing their root cause in that case, which is bone that is going away, and we revolumize it and it takes it away. In other people, the lower lid fat pads are significant enough in size that even if you did that, you would still notice that the person had a baggy look to their lower lids, making them usually look tired. Often after upper lid surgery, and incidentally, there's almost no substitute for upper lid surgery. You can try to, if the brows are a little low, get them to increase in height by using a botulinum toxin like Botox or Xeomin or concentrated Dysport. You can also use volumizers and fillers to help out somewhat the contours of the outer portions of the brow. Again, all those things can help lift the brows a little bit and make the lids look a little less heavy. But for many people, they still have a significant enough of excess skin, known as dermatochalasis, and or excess fat pads, referred to as prolapsed orbital fat pads, that they need to be removed, and that's done surgically, since when we're dealing with the upper lids, the main purpose of those lids is to protect the eye, and as a consequence we are very limited in what we can do to that upper lid skin without putting the eyeball at risk. My area of expertise, incidentally, is in oculoplastics, which means the area that I am most specialized in surgically are surgeries of the eyelids and the eyebrows being present to protect the lids and the eyeball. Anyway, please tune in on Tech Tuesday to find out exactly how I do that. Also, if you want a short version of this, go to our Instagram page. Thank you. Bye-bye.